Perhaps it's time we shift politics away from governance with the resurgence of Ebola virus disease, EVD, in Liberia, Sierra Leone, and Guinea. What will be the next Ebola containment strategy for the survival of the West African region? Welcome to Question Time. I'm Benga Ashiru. On July 20, 2014, a Liberian, late Mr. Patrick Sawyer, came into Nigeria with a deadly Ebola scourge. It was in this process that he had contacts with over 300 people in Nigeria, in which 20 cases were reported, out of which 12 survivors were recorded. On August 8, 2014, the federal government declared a national emergency on Ebola with the release of 1.9 billion naira intervention fund. On October 20, 2014, which marks the 42nd day of Nigeria's effort in containing the spread of Ebola virus, Nigeria was declared Ebola-free, Ebola transmission-free by the World Health Organization. That was like a cherry news. But now, while there was also a reported drop in Ebola cases in other West African states, perhaps the Ebola fighters let off their guards too soon. Now the West African coast contend with a resurgence of the Ebola virus with cases in Liberia, Sierra Leone, and Guinea. Channels TV was at the National Center for Disease Control, where we had a chat with the national coordinator, Professor Abdusalam in Nasidi. It says Nigeria is set to take the fight against Ebola transmission to its flashpoints, which are Liberia, Sierra Leone, and Guinea.
Nigeria is as safe as we remain vigilant, and then we intensify our border activities in the ports, seaports, and land borders, and at the same time we empower our health facilities to be able to diagnose and isolate urgently or immediately.
Would you say Nigeria is letting down its guard in the prevention of Ebola and also curbing the spread of Ebola across West Africa? I
wouldn't think so. If anything at all, we have increased our activities at the borders. For instance, when we started, we had only 6 ports where we have these temperature scanning cameras mounted, and now we have 12. Virtually all the major airports where we have international flights are now being monitored. We have at land borders handheld scanners still active, and above all, we really have very active surveillance going on how to pick these cases. All our health facilities that need to be mobilized are on guard, but nevertheless we need to intensify, and we have now laid out series of activities that the Ministry of Health will soon embark on to reawaken the process again.
How far is Nigeria ready to go in tackling this scourge? Are we going to extend this campaign beyond our frontiers in tackling this scourge, taking it headlong to this country, because considering the interactions and the proximities of these countries to Nigeria?
Actually, as I'm talking to you, we have about almost 20 Nigerian experts in Liberia and Sierra Leone, and the other African experts in Guinea working with the experts of these countries. And we just have about 187 return, from providing service to this country. So a Nigerian, Dr. Basanya, is actually the deputy commandant of the African ASEOA program, the fight against Ebola, and is still there in Monrovia coordinating, providing support. And we just also have been working with what they call West African Health Organization to intensify our ability to monitor the borders. And of course, the most important is WHO is coordinating most of these surveillance activities in the sub-region. We have the NCDC collaborating with us, other international agencies like Bill Gates Foundation, even Dangote Foundation is assisting beyond Nigerian borders. And I'm very happy to also announce that the private sector, particularly the oil companies, they are contributing a lot to increase our preparedness and readiness. So we actually have what we call the post-Ebola containment preparedness and response plan. And that plan is for 4 years. And we have already reactivated. The Permanent Secretary just approved its immediate reactivation, and you soon start hearing activities that we are going to be pursuing to again sensitize all healthcare workers that this thing is still around. Don't go to sleep. It's not yet time to relax. And also we shall use, the health promotion, the media, as I'm talking to you now, to sensitize Nigerians, to alert them and make sure that they know that we are still in danger.
Before last year, the records were so impressive, the way Nigeria rose to the occasion. But now, what would you say are the factors that are responsible for the resurgence of Ebola in West Africa?
We managed to succeed in interrupting transmission in only Liberia. Meanwhile, in countries like Sierra Leone and Guinea, the cases also went down substantially. But towards the end of May, June, we started seeing what is called flare-ups. That is, you have sporadic cases in limited areas, all scattered. So it became frightening that this virus might not have really gone totally. So the unfortunate thing is that the moment Liberia was declared Ebola-free by the WHO, because they sailed through the 42 days, most of the donors, most of the experts started leaving these countries, thinking that this thing is going down. And then the sad news is on the 29th of June, a very terrible experience occurred. Liberia was reinfected. A 17-year-old boy who was living in the village not far from Monrovia died. And when he died, as at that time, Liberia was about 45 days to the 90 days a continuous active surveillance, meaning that any death must be investigated before we now say, okay, finish, no more virus. So on the 44th day of fifth day, this boy died, and his samples were taken. And unfortunately, he was confirmed to be having Ebola. He must have died. He should have died of Ebola.
You can join in this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, what are the early warning signs of Ebola virus infection? Find out after this break.